Dr. Alvin Williams, and I'd like to welcome you today for a brief talk on exosomes. Exosomes came around basically as a result of stem cell therapy. I've been doing stem cell treatment for quite some time, where we actually use live stem cell, which you have to keep in a nitrogen tank at a certain temperature below Celsius. The live stem cells were very expensive, and for example, 1 milliliter of live stem cell is not equivalent as far as dosage of exosomes to 1 milliliter of actual exosomes at this point. And the reason why I say this is because the revolution of exosomes came from the fact that stem cells, when injected and they die, they release exosomes. And I'd like to read to you a very simple excerpt on what exosomes are. Exosomes are microvesicles. They're 30 to 150 nanometers, which are very important for human cell-to-cell communication. They're involved in cell signaling. And that's important because they actually are the recruiters to get the actual stem cell to the area that it needs to be when you inject exosomes. They do not contain any nucleus or dead DNA. They do contain a lot of growth factor and cytokines. And they're regarded as some of the purest form of cellular therapy available because their primary function is to direct tissue and wound healing by the activation of the patient's own regenerative cellular response. In English, basically, exosomes are soldiers that go out there and recruit other soldiers to do the work in cleaning up the immune system, to get the immune system to function better and more effectively. They're very small, so they can cross the blood-brain barrier and they can cross into the lipid membranes, so they can be targeted for a lot of different functions, which we'll talk about in a few minutes. So that's exosomes. So instead of going and using live stem cell, we now use exosomes. And one of the articles that I'll show you on the screen in a little while is titled Exosomal Therapy, a New Frontier in Regenerative Medicine. Now, this is a very wonderful PubMed article on stem cell investigation, where it talks about exosomal therapy, a new frontier in regenerative medicine, which I talked about. And this is where I want to really focus on, is that there are many studies in vitro that exhibit a high safety and efficacy of the therapeutic potential of exosomes in various cancers, regenerative medicine, cardiovascular, orthopedic diseases. So there is that factor of safety that I mentioned to you, where I believe it's actually safer than steroid usage, and actually believe that the benefit is longer and actually more effective because you're actually doing something to regenerate and heal and reduce inflammation using your own body's potential versus using steroid, which basically covers up the problem and really doesn't add any potential benefit for the future. That's why you have to have injections of steroid on a regular basis. This versus this may be once or twice, maybe 3 times at the most, to treat a particular problem, and you usually get great results. So that's exosomes in a nutshell. They have a diagnostic role, which we'll not talk about because that's for gene therapy and also other types of treatment. But I'm going to talk about the therapeutic role of exosomes. And the most important thing about the therapeutic role of exosomes, from my perspective, is a key word: anti-inflammatory. That goes along with why we use steroid, because steroid is anti-inflammatory. But exosome, which is also very strongly anti-inflammatory. And the reason it's good is because it actually lacks the inherent risk associated with cellular-based or stem cell therapy. It also lacks the replication potential and the risk of malignant transformation. So it's a safety effect of using exosomes because you don't have the potential risk of malignant transformation when you use, as if you were to use stem cell therapy. It also lacks immunogenic response towards infections and cancer. And it's a targeted action treatment, so it's targeted to different areas. The sources of exosomes is how you isolate it from what they call mesenchymal stem cell. That's MSCs, which you can get from bone marrow, adipose or fat tissue, placenta, umbilical cells, endometrial fluid, or amniotic fluid. The product, I've used several different exosomes, but the one that I'm most impressed with is this one called MaviX. And MaviX is by a company called Exosome out of Austin, and they actually manufacture this here in San Antonio. MaviX has, each milliliters of MaviX has about 20 billion exosomes. Each milliliter of MaviX has approximately 20 billion exosomes. So in addition to the exosomes, MaviX also has the naturally occurring growth factors. It has a messenger microRNA, that's the exosomes. It acts as a signaling molecule. It contains chemokines, cytokines, enzyme inhibitors, lipid glycoproteins, and peptides. And this product is actually from the placenta. So it's a special way that they manufacture it, that they use the placenta, which is donated placenta, nothing to do with abortion, is donated placenta that they obtain, and they use a special process to create a lyophilized product, meaning that it's dry freeze. The really importance of this is that now you can take this and get it all over the world, because it also has a 3-year shelf life. So it has a long shelf life. It's transportable all over the world. It doesn't have to be frozen. It doesn't have to be specially packaged. It can be sent over by FedEx. So I use the MaviX system, and the reason why I like to use it because when I use the MaviX, because it's lyophilized, I can mix it with your platelets, which you call PRP, or I can use it without mixing the platelets, using it with regular normal saline. So I really like this product. The way that you can deliver exosomes, you can do it intravenously, you can do it intrathecally into the spine, you can do it epidural, you can do it intramuscular or subcutaneous. The reason why I said that I'm excited about the use of this exosome as the new frontier because I've been practicing pain medicine, anesthesia for 29 years, more than almost 30 years. And we've used steroid, and steroid is actually not FDA approved for spinal injection. They have a big black box warning on steroid usage. So, but we use it because it's the standard of care. So we use steroid injection, and there are different types of steroid. Some of the ones that are longer lasting has a very high risk of complications. And the reason why we use steroid is because of its anti-inflammatory potential. Remember I said the word to you earlier. So now we have exosomes which are safer than steroid, which has strong anti-inflammatory potential, and I've used it in just about every form that you could think of. I've used it with the appropriate consent, that it's not FDA approved. It's considered investigational and experimental. This is a disclosure that I give to all patients. And you have the right to choose. It's your body. You have the right to choose something to do that may be potentially beneficial and had very low risk. Once again, very low risk. So you can use exosomes, the one I use in MaviX, and I've been using it instead of steroid to do epidural injections. I do injection into multiple joints, into tendon and tissue, and their success rate has been tremendous. And that's why I believe it's the new frontier of regenerative medicine. I believe it's going to be the new frontier of pain management. The results are between 4 to 6 weeks, and it can be sooner, it can be a little bit more delayed. And you can use exosomes with a variety of other things, such as mixing with your platelets, and also using it in combination with ozone therapy. So the benefit that you have is all the beauty of having regenerative medicine, using your platelets, using ozone therapy to try to get the most optimal healing process of your body. And that's the talk about exosomal therapy. And I'm very excited that it's really a new frontier. One drawback is not FDA approved, so therefore insurances are not covering this treatment. So therefore it's an out-of-pocket expense. But it's one of the things that I believe that's very much worthwhile if you can get the results I've been seeing in the last few years using this product. Thank you once again, and have a wonderful day.